child has an IQ of 100. And most people have that average level. But it's the two tails, here and here, which are particularly significant in this discussion. Those two areas under the curve, the green area, are the total number of kids in our society who are very, very bright and geniuses. And the curve, this area here, is the total number of kids who are mentally handicapped. Now, if you shift the curve over by 5 IQ points, and we think we did that when we had lead in gasoline, the parent would not notice this shift in the average kid. If you had two children, one had an IQ of 100, one had 95, as a parent you wouldn't notice. You wouldn't know. As a school teacher you wouldn't know. So we're blind to the average child here. But look what happens to the tails when you shift that curve over by just 5 IQ points. You halve the number of geniuses in your society and you double the number of mentally handicapped. That has enormous social and economic ramifications for a country like the United States. Once we know that a chemical that our kids are being exposed to on a daily basis has the potential of affecting the brain, that is the signal to get it out. And I would remind you that San Francisco has the precautionary principle. And if you don't think the precautionary principle should kick in when we're talking about saving a small fraction of a tooth surface in exchange for possibly shaving off a few IQ points, if that doesn't trigger the fluoridation, the precautionary principle, then nothing will. Yeah. Concerns in this book, chapter by chapter by chapter. I don't have time to do that. The question is why? Why do health agents continue to promote this thing? You've got to look at the top of the chain of command of the health agencies. The bottom levels of the chain of command of the dental lobby and the public health people. At the bottom you've got dentists and doctors. Most of those dentists and doctors are only taught one thing at dental school and medical school. And when they graduate and have their own practices, they don't have the time to do what 3 retired professors could do, study the literature in depth. So they tend to go along with their professional bodies and government agencies. Now go into the middle level of the bureaucrats. The middle level of bureaucrats learn very quickly that you don't create waves in a bureaucracy. You don't challenge policy. Your job is not to challenge policy, but to carry out policy. So these people are the cogs that carry out the instructions from the top. So we were trying to understand why this continues. It's not because of the middle level bureaucrats, they're just doing their job as they see it, nor the people at the bottom. It's got to be the people at the top that you examine. What they're frightened of is losing credibility. The equation is if you lose fluoridation, you lose credibility. If you lose credibility, you lose or threaten the public's trust in other important public health policies. In other words, what we are looking at here, and this is conjecture on my part, you can take it or leave it. What we're looking at here, all this politics and all this money and all this PR spend, is not to save a fraction of a tooth surface. It is to protect other public health policies. And those other public health policies include vaccination, which is a multi-billion-dollar industry in this country. My response is, every day they continue to promote this bogus practice with the pathetic science, they're losing their credibility, and the quicker they reject it, the better. Better alternatives. If you want fluoride, use fluoridated toothpaste. I don't. Better still, use xylitol toothpaste. Xylitol is a natural sugar. We produce it in our own bodies every day, about 15 grams of it. And the beauty of xylitol is that it prevents the bacteria that convert sugar into acids from sticking to the teeth. And if they can't stick to the teeth, they can't survive in the mouth. They've been using this xylitol toothpaste, xylitol mints, in Scandinavia for over 30 years and in Japan. Now the other thing which is nice about this is that, I've got to finish in just a couple of minutes. The other thing that's nice about this, if you protect the mother, you will also protect the baby. Because the mother has exchange of bacteria with the baby. So protect the mother with xylitol toothpaste and protect the baby. Also, you can give xylitol mints to children in low-income areas, in school in low-income areas. Give them a mint to suck on in the morning, a mint to suck on in the afternoon. Give free toothbrushes and free toothpaste to low-income families. They're doing that in Scotland right now. They're doing that in northern New Zealand. It's proving very effective. Most of tooth decay is concentrated in low-income families. Most distressing tooth decay is baby bottle tooth decay that cannot be corrected by fluoride, fluoridated water. This is when a baby sucks on a bottle for hours on end with sugared water, fruit juice, Coca-Cola even. It rots the primary teeth down to the gums. Low-income families need better diet and better dental education. More brushing, less sugar. Less sugar, less sugar. 1 year before the United States government endorsed fluoridation in 1950, the sugar lobby said, we need to find a way to reduce tooth decay without reducing sugar consumption. And they then backed fluoridation to the hilt. And the end result is that not only have we not cured tooth decay, but we've got a massive epidemic of obesity because parents have taken the eyes off the prize. Get rid of that sugar. Get the soft drinks out of schools. And if you combine the battle against tooth decay with the battle against obesity, you can have all the money that you could possibly want for that education, because obesity is going to cripple the healthcare system in this country. Now, how can we end fluoridation in San Francisco? Effective change is like driving through a nail through a piece of wood. The experts can sharpen the nail, but they can't push the nail through the piece of wood. In other words, I can't stop fluoridation in San Francisco. I hope I've sharpened a few nails here to give you the kind of ammunition that you can stop it. So you need the hammer of public opinion to drive that nail home. Ending fluoridation is as easy as turning off a tap, a spigot at the public waterworks. You just need a strong wrist. But to do that, you need the political will to do that. And to get that political will, you need many more people educated and organized. And today is the beginning of that process in San Francisco. It's a historical moment, as is on your posters, because you've done both. You've organized people to come to a rally, and you've come and you've got those people there to get educated and more nails sharpened. We have to end fluoridation one open mind and one community at a time. The resources are available. This is available online. You can get it via our website. This book is available. This would take you several months to study that. It's pretty dense. This might take you a couple of weeks. This videotape that was being shown at the beginning is our most powerful weapon. It's only 29 minutes long. I urge you to get a copy of this, a hard copy. Make as many copies as you can. Get it to your friends and everybody that you know. Our fan website is fluoridealert.org. There's a fantastic health database there. You go to the website, click on researches, you'll find all the papers dealing with fluoride's impact on 14 different tissues. San Francisco has adopted the precautionary principle to inform its policies. If the PP doesn't apply to fluoridation, then you might as well get rid of it. And that might be a good campaign. You might suggest that San Francisco stop applying the precautionary principle because you don't use it. And see, I've written a whole chapter on this, on the precautionary principle, in our book. Now, in that, we produce some criteria. Is there published evidence of harm? That's the first obstacle you have to overcome. Yes, 36 IQ studies. Is this effect serious? Yes, it's very serious if we're lowering the IQ of our kids. Is the benefit being pursued very significant? No. A fraction of one permanent tooth surface saved? That's not significant. Are there alternative cost-effective solutions available? Yes. Fluoridated toothpaste and xylitol. There are alternatives. And how can counselors deal with the pressures from the dental lobby? This is what happens. We sometimes get victories, right? We sometimes get victories, and at the next council meeting, there's a huge posse of dentists and pediatricians saying, you're going to ruin our kids, our poor kids, you can't stop this, blah, blah, blah. They get completely intimidated, and sometimes reverse the situation. So this is the armament. This is the armament that you can give to increase their testicular fortitude. Very simple. Get them. Ask the promoters of fluoridation organization to produce one dentist, doctor, scientist, or public health official from North America who will defend the case for fluoridation in an open public debate with Professor Paul Connett. I pledge I will come back to San Francisco almost at any time. These communities have stopped fluoridation in Australia, in Canada, in the United States. It's almost one every 2 or 3 days over the last few years. 19 communities representing 950,000 people in 2008. 2009, 4 communities over 140,000 people. In 2010, 8 communities over 129,000. 2011, 33 communities over 1.9 million, 26 communities over 780,000 2012, and this year already 45 communities over 800,000. In total, it's over 120 communities since, I think, 2008, representing 4.6 million people. Hopefully, you will add San Francisco to the list. San Francisco!